When you look at a sparkling, perfectly blue swimming pool on a hot summer day, you probably just see the ultimate summer refresher.
Right, exactly.
But if you've recently had a gynecological procedure, or maybe you're navigating the final weeks of a pregnancy, that inviting water isn't just a place to cool off. It is actually like a highly engineered, microscopic chemical battlefield.
It really is. I mean, we tend to think of swimming solely as a physical exertion metric, right? Like we
Wow.
measure it against jogging or cycling.
Yeah, totally. Just another workout.
Right. But from a clinical perspective, the exertion is entirely secondary. The primary concern is environmental exposure,
Okay, meaning what exactly?
meaning pools, hot tubs, and lakes are communal immersion environments. They introduce novel bacteria, radical pH fluctuations, and, really aggressive sanitizing chemicals directly to your body's most sensitive ecosystems.
Which brings us to our mission for you today. We are taking a deep dive into a highly specific, yet practically universal question for anyone navigating women's health.
And that is,
How soon can I return to swimming?
yes, the golden question.
Right. To find the definitive answers, we are synthesizing a massive stack of sources today. We're pulling apart clinical aftercare leaflets, NHS surgical guidelines, obstetric protocols, and contrasting all of that with real-world forum discussions to figure out exactly how to navigate the water safely.
And the necessity of combining those clinical guidelines with real-world experiences is paramount here. Because, frankly, the medical advice can feel wildly contradictory.
Oh, completely.
The mandated wait times to get back into the water range from a mere 24 hours to a really grueling 6 weeks. And it is entirely dependent on the specific physiological trauma or transition your body is managing at the time.
Okay, let's unpack this by starting at the lower end of that timeline. We'll call this first category the quick bounce-back procedures.
I like that.
Yeah, this encompasses routine in-clinic interventions. So specifically, having an IUD fitted or undergoing a simple cervical or endometrial biopsy.
Right. So for an IUD insertion, regardless of whether you choose a copper device or a hormonal option like Mirena, the standard clinical protocol dictates avoiding complete water immersion, meaning swimming or baths, for 24 to 48 hours.
Just a day or two.
Exactly. Now, the timeline for a simple biopsy, which involves excising a superficial tissue sample, is slightly more extended.
Yeah.
It usually requires about a week out of the water or, until any localized spotting completely resolves.
Okay, so the actual lived experience of that first category is so fascinating to dig into. I was reading this massive Reddit thread that was specifically framed as an IUD survival guide.
Oh, wow. I can only imagine.
Yeah, users were swapping these incredibly visceral stories about insertion day. You have people crowdsourcing protocols like taking specific doses of ibuprofen an hour beforehand.
Which is very common advice, yes.
Right, and warning each other about the sudden waves of dizziness. One user detailed nearly passing out on the table and waking up to the clinic receptionist enthusiastically pumping her full of sugary apple juice.
Yeah, that phenomenon she experienced is actually a vasovagal syncope response.
Vasovagal syncope.
Right. So the cervix is densely packed with nerve endings that communicate directly with the vagus nerve. And that's a primary component of your parasympathetic nervous system.
Okay.
So when the cervix is manually manipulated or dilated, it can trigger this abrupt, involuntary drop in both heart rate and blood pressure.
Oh, so that's why she almost passed out.
Exactly. The brain is momentarily deprived of optimal oxygen, leading to that dizziness or fainting. The apple juice provides a rapid glucose spike to help stabilize the system.
Wow. Okay, that physiological cascade makes total sense. But here is the disconnect for me based on those timelines we just talked about.
Go on.
The actual IUD insertion, like the physical manipulation of the cervix, takes maybe 2 minutes.
If that, yeah.
Right.
Yeah.
So in my head, I've been visualizing the cervix as the bouncer at an incredibly exclusive club, the club being the uterus, obviously.
Yeah.
The bouncer opens the door, the IUD is slipped inside, and the door slams shut. If the mechanical procedure is over instantly, why are we worried about pool water for 2 whole days? Does the bouncer just go on a smoke break?
That is a great visual. Your bouncer analogy is structurally sound, but we need to adjust the physical reality of the procedure a bit.
Okay, hit me.
When a physician dilates the cervix for an insertion or a biopsy, they aren't politely asking the bouncer to open the door. They're essentially putting the bouncer in a temporary chokehold.
Oh, wow. Okay.
Yeah. You are mechanically forcing open a tightly closed, heavily muscled sphincter and disrupting the natural cervical mucus plug that acts as a chemical and physical barrier.
Ah, so it's about muscle tone recovery and reestablishing the perimeter.
Precisely. It takes roughly 48 hours for the cervical tissue to fully contract back to its baseline resting state, and for the localized mucus barrier to regenerate and stabilize the environment.
So if you go swimming right away,
If you introduce pool water into the vaginal vault during that window of vulnerability, you are flushing opportunistic environmental bacteria upward, directly toward a compromised barrier.
that makes total sense.
Yeah, the risk of developing an ascending pelvic inflammatory infection is exponentially higher when that muscular door is even fractionally ajar.
Okay, so we've just talked about the minimal downtime when we artificially force the cervix open for a brief moment. Here's where it gets really interesting.
Oh, definitely.
When we transition from minor mechanical interventions to actual surgical tissue removal, that waterband timeline completely skyrockets.
We shift from discussing a matter of days to a strict mandate of several weeks.
Right. We're looking at procedures like LAETZ, the large loop excision of the transformation zone, where they use an electrified wire loop to excise precancerous cells from the cervix.
Yeah.
We're also looking at hysteroscopies, which involve feeding an operative camera deep into the uterine cavity to resect polyps, as well as medical and surgical abortions.
Right, much more involved procedures.
Exactly. And across all these distinct medical interventions, the sources unanimously dictate a swimming ban ranging from a minimum of 2 to 4 weeks, frequently extending to 6 weeks.
Which naturally invites the question of what biological mechanism requires a 6-week ban from a chlorinated pool.
Well, I actually found a detail buried in the NHS aftercare leaflets that I think illuminates the severity of that timeline. And honestly, it's a detail that sounds terrifying if a doctor doesn't warn you about it beforehand.
I know exactly what you're going to say.
Right. The leaflets state that around a week after a cervical biopsy or a LLETZ treatment, you might suddenly experience a heavy discharge that appears black, flaky, or distinctly yellowish.
Yeah. And while visually alarming to the patient, that is actually a perfectly orchestrated phase of the cellular healing process.
Really? Black, flaky discharge is perfect.
I know, it sounds crazy, but when a physician excises cervical tissue with an electrified loop, they leave behind a raw, actively bleeding wound bed. To instantly halt that hemorrhage, they apply a chemical cauterizing agent. Most commonly, it's a paste called silver nitrate, or Monsel's solution.
Okay, wait. I understand heat cautery, like burning something to seal it. But how does a chemical paste actually stop active bleeding on a cellular level?
So silver nitrate essentially forces an immediate chemical burn.
Ouch!
Yeah. The silver ions react violently with the proteins in the exposed tissue. It precipitates them out of solution and causes the raw tissue to instantly coagulate.
Wow.
This forms a thick, localized Escher, basically an artificial chemical scab, so that black, flaky discharge patients see a week later. That is simply that silver nitrate Escher naturally sloughing off as fragile new granulation tissue begins to form underneath it.
Okay, visualizing that fragile raw granulation tissue completely changes the perspective on swimming.
It really does.
I mean, if you have an open, chemically cauterized wound regenerating in a dark internal environment, submerging yourself in a public pool filled with microscopic pathogens and harsh sanitizing chemicals, that sounds like an active sabotage of your cellular repair.
It is active sabotage. Chlorine is designed to indiscriminately lyse or break open the cell walls of organic matter in the water.
Right.
Exposing raw, developing capillary beds to that chemical environment not only risks severe infection, but it can chemically burn the new tissue, which severely delays the overall healing timeline.
And realizing that mechanical dynamic completely recontextualizes another strict rule plastered across all these leaflets.
The tampon ban.
Yes, the absolute ban on using tampons during that multi-week recovery window. I was just thought of a tampon as a passive sponge. But if you think about the actual physics of it, a tampon relies on capillary action.
That is the exact hazard.
The tightly woven rayon and cotton fibers are designed to aggressively wick moisture upward. So if you get into a pool wearing a tampon, it isn't just blocking the water.
No, not at all.
It is actively drawing chlorinated, bacteria-laden pool water up the vaginal vault and pressing that toxic chemical cocktail directly against a raw, granulating cervical wound for hours.
You've perfectly articulated the mechanical failure of internal menstrual products in aquatic environments post-surgery. You are essentially transforming a sanitary product into a targeted chemical delivery device.
A targeted chemical delivery device, that is a horrifying image.
It is, and this is why external sanitary pads are non-negotiable until the physician confirms the mucosal barrier is fully restored.
Wow. Okay, so we've covered the extreme lengths the body goes to heal when we surgically force that cervical door open. But the body also has a built-in biological mechanism for opening that door naturally.
Which brings us to the complexities of late-stage pregnancy.
Exactly.
Specifically, the physiological transition signaled by the loss of the mucus plug.
Right. So for listeners who haven't encountered this, throughout a pregnancy, the cervix generates and maintains a dense, gel-like matrix of mucus that seals the cervical canal. It's a physical blockade protecting the sterile uterine environment from the outside world.
A very effective one, too.
But as the body prepares for labor, the cervix begins to soften and dilate, and that plug can dislodge.
Right. It is a critical milestone in the final trimester. It signals that the structural integrity of the cervix is intentionally yielding in preparation for birth.
But the clinical advice regarding water exposure after this milestone is wildly fractured in our sources.
Yes, it is very confusing for patients.
I am looking at established health websites that are incredibly rigid. They explicitly warn pregnant women to avoid baths and swimming immediately after losing the plug, citing a highly elevated risk of infection.
And that represents the most conservative liability RF clinical protocol.
Sure, but then I cross-referenced that with a Reddit community dedicated to expectant mothers. A user posted asking if she could still swim after losing a significant portion of her plug at 37 weeks.
Let me guess. Lots of conflicting opinions.
So many. The thread was flooded with women sharing contrasting anecdotes. Like, one woman swam in the ocean until nearly 42 weeks, and the original poster later updated the thread, stating her certified midwife cleared her for daily pool sessions because, according to the midwife, the mucus plug continually regenerates.
And the midwife's biological premise is entirely accurate.
Wait, really?
Yes, the mucus plug is not a static, inert cork like you'd find in a wine bottle. It is a dynamic, constantly regenerating immune barrier packed with antimicrobial peptides. The cervical glands continually secrete this mucus. You can absolutely lose portions of the plug or even the entire structure multiple times in the weeks preceding labor, and the body will simply manufacture more.
See, I am struggling to reconcile those two realities. How are you supposed to know what to do when a clinical article explicitly flags the pool as a biological hazard, while an experienced medical professional encourages you to jump in because the body rebuilds the barrier?
You reconcile it by understanding that they're evaluating two entirely different risk profiles.
Okay.
The midwife is operating on the knowledge that the baby is not reliant solely on the mucus plug. The fetus is sealed inside the amniotic sac, which acts as a pressurized, sterile hydrostatic barrier.
Right, the water hasn't broken.
Exactly. Until that sac ruptures, until your water breaks, the baby is heavily insulated from ascending pathogens.
Okay, so the baby is secure in their own pressurized hydrostatic vault. But I'm guessing the clinical websites aren't worried about the baby in this specific scenario. They are worried about the mother's tissue.
Exactly the distinction. The mother remains vulnerable to an ascending uterine infection, clinically known as chorioamnionitis.
Wow.
Without the dense mucus barrier fully intact, environmental bacteria from standing water can traverse the vaginal canal and colonize the external uterine environment.
That sounds dangerous.
Very. Developing a severe uterine infection days before you were expected to endure the immense physical trauma of labor is a catastrophic complication.
Which explains the nuance in the final recommendation I found in the clinical literature, which is that showers are perfectly fine, but immersion in a bath or pool is the hazard.
Yes, it's a matter of fluid dynamics.
Right, because in a shower, gravity constantly washes the water down and away. But when you immerse yourself in a tub or a pool, the water is allowed to enter and pool in the vaginal fornices, dramatically increasing the bacterial load the local immune system has to fight off.
Fluid dynamics dictate the risk. It is important to emphasize that losing the plug does not indicate imminent labor. You can still be weeks away from delivery. But the clinical consensus remains that once that structural barrier begins to compromise, substituting your daily swim for a shower is the most scientifically sound strategy to prevent prenatal infection.
Okay, that makes perfect sense. Let's shift our focus away from surgical recovery and pregnancy entirely. Let's look at everyday vaginal health.
Let's do it.
Say you haven't had a LLETZ procedure. You aren't managing an IUD, and you definitely aren't pregnant. Does that mean a chlorinated pool is a completely risk-free environment for your everyday microbiome?
Far from it. Even without underlying medical interventions, immersing yourself in a highly engineered chemical bath disrupts your body's baseline homeostasis.
I think almost everyone listening has experienced the anxiety of this disruption. You know, you spend a long Saturday at the municipal pool, and by Sunday evening, you are battling severe itching, localized dryness, or a highly unusual discharge.
Yes, very common.
And the immediate panicky assumption is always that you've contracted an infection from dirty pool water.
It is the most common diagnostic leap patients make. But the primary culprit is rarely a pathogen introduced by the water itself. We have to clearly differentiate between acute chemical dermatitis, which is chlorine irritation, and a genuine microbial infection.
Okay, so looking at the diagnostic criteria in our sources, the timeline seems to be the dead giveaway here.
It's-
Acute chemical irritation is usually localized to the external tissue, like redness, dry skin, superficial itching. But crucially, if you shower thoroughly with fresh water, that irritation begins to rapidly subside within 24 to 48 hours. The baseline discharge doesn't dramatically change.
Your deduction is spot on. A true infection does not resolve on its own in 48 hours. It proliferates.
Right.
If a patient presents with thick, white, cottage cheese-like discharge accompanied by intense internal itching, we're looking at a localized overgrowth of candida, a yeast infection.
Okay.
Conversely, if the discharge presents as thin, grayish-white and carries a highly distinct fishy amine odor, the diagnosis is typically bacterial vaginosis, or BV.
But wait, if the pool water is heavily sanitized, why is it triggering yeast, or BV?
Because chlorine is too good at its job.
Too good.
It is a broad-spectrum biocide. When chlorinated water enters the vaginal canal, it doesn't just neutralize exogenous threats. It aggressively slays the cell walls of your body's most crucial defensive organism, lactobacillus.
Ah, the foundational pillar of the vaginal microbiome.
Exactly. Lactobacillus is the keystone species. These beneficial bacteria metabolize glycogen in the tissue to produce lactic acid, maintaining a highly acidic environment, usually at pH around 3.8 to 4.5.
Right.
This acidity is the chemical shield that suppresses the growth of opportunistic yeast and the bacteria responsible for BV, like Gardnerella.
Oh, I see where this is going.
Yeah, when chlorine wipes out your lactobacillus population, the local pH spikes. Without that acidic suppression, yeast and Gardnerella seize the opportunity to rapidly multiply and colonize the space.
Okay, that chemical cascade makes perfect sense. But I want to push back on a detail I found in the sources regarding midlife women.
Okay, what did you find?
The literature specifically highlights that dropping estrogen levels during perimenopause and menopause dramatically exacerbates this post-swim irritation.
It absolutely does.
But I always conceptualize estrogen strictly as a reproductive hormone, you know, something that triggers ovulation or regulates a menstrual cycle. How does a reproductive hormone structurally alter the tissue's resilience to chlorine?
That is a very common misconception about estrogen. While it governs reproduction, estrogen is also a fundamental structural hormone for mucosal tissues.
Really?
Yes. Estrogen is directly responsible for maintaining the thickness and the elasticity of the vaginal epithelium. More importantly, estrogen drives the production of glycogen within those epithelial cells.
Oh, wow. So it's a direct biological feedback loop.
Completely. Estrogen ensures the tissue is saturated with glycogen, which, if you remember, is the primary food source for the lactobacillus.
Right.
When estrogen levels plummet during menopause, glycogen production crashes. Starved of their food source, the lactobacillus population shrinks, weakening the acidic shield. Simultaneously, the physical tissue becomes significantly thinner, less elastic, and highly friable.
So you have a patient with an already depleted lactobacillus population and physically thinning tissue, and you submerge them in harsh, moisture-stripping chlorine.
Exactly.
The structural integrity of the tissue just can't withstand the chemical assault, leading to microtears that invite even more inflammation.
The clinical term is atrophic vaginitis, and it turns a simple swim into a catalyst for severe discomfort. For individuals in midlife navigating chronic post-swim infections, the most effective intervention isn't usually an over-the-counter antifungal cream, but rather discussing localized vaginal estrogen therapy with their physician to literally rebuild the structural integrity of the tissue and fuel the microbiome.
That is an incredibly empowering piece of knowledge to have in your medical toolkit.
I completely agree.
Speaking of navigating the pool, we also need to touch on the evolution of swimming gear for those managing their menstrual cycle. As we discussed earlier with capillary action, tampons and even menstrual cups are the standard internal protocols for swimming. But the sources highlight that internal products are medically impossible for a significant demographic.
Yes, we have to consider patients suffering from conditions like vulvodynia, which manifests as severe chronic neuropathic pain around the vaginal vestibule.
Right.
For these individuals, inserting any internal product triggers agonizing pain. Additionally, many adolescents simply do not possess the anatomical familiarity or comfort level required to manage internal products.
And historically, if you fell into those categories, you were simply exiled from the pool during your period.
Basically, yes.
But the sources showcase an incredible leap in material science. Swim-friendly period swimwear. And these aren't just thick pads sewn into a bikini.
No, the technology is quite advanced.
They utilize advanced hydrophobic layers designed to immediately trap and lock away menstrual fluid without simultaneously absorbing the surrounding pool water. It's a brilliant application of external, quick-drying technology that entirely bypasses the need for internal insertion.
The inclusive engineering is remarkable. But what's fascinating here is, whether you are utilizing hydrophobic swimwear, recovering from a minor biopsy, or just trying to maintain your baseline microbiome, there is one universal, non-negotiable directive highlighted across every single medical source we reviewed today regarding post-swim hygiene.
Let me guess. It has absolutely nothing to do with buying those heavily marketed pH-balancing intimate washes.
Spot on. Those heavily fragranced washes frequently contain irritants that further disrupt the lipid barrier of the skin. They should be avoided entirely.
So what is the directive?
The most scientifically effective preventative measure is remarkably simple. Remove your wet swimsuit the absolute second you are done swimming.
Do not sit around on the lounge chair in damp spandex.
Never linger in wet synthetic fabric.
Yeah.
A tight wet swimsuit sitting against the body acts as an incubator. It traps ambient body heat and heavily chlorinated moisture against the skin, creating the ultimate warm, damp, occlusive environment. It is the perfect biological breeding ground for fungal spores and opportunistic bacteria to thrive. Rapidly changing into dry, breathable cotton underwear the moment you exit, the water physically removes the incubator, solving half the battle before the microbiome is even fully challenged.
So what does this all mean? If we consolidate everything from this deep dive into the complex waters of women's health, here is your definitive recovery timeline to mentally bookmark.
Let's hear it.
If your cervix has been briefly manipulated for an IUD fitting, give your body 48 hours to let the muscular bouncer resecure the perimeter. If you've had a simple biopsy, wait a week for the localized trauma to resolve. If you've undergone major interventions like a LLEPZ, a hysteroscopy, or an abortion, you must respect a strict 2 to 6 week ban to ensure raw, chemically cauterized granulation tissue doesn't become a sponge for aggressive pool chemicals.
Furthermore, if you are in the final weeks of pregnancy and observe the loss of your mucus plug, mitigate your risk of a prenatal uterine infection by swapping the pool for a shower.
And for everyone else, just trying to survive a regular Tuesday at the municipal pool without triggering a microbiome collapse. Understand how chlorine disrupts your protective acidic shield and physically remove that wet, incubating swimsuit the second you step onto dry land.
To leave you with one final thought to mull over, consider the profound irony of our modern recreational engineering. We deploy powerful, indiscriminate chemicals like chlorine to forcibly sterilize our communal water, desperately trying to make the environment safe for our bodies.
Right.
Yet the very act of immersing ourselves in that sterilized water chemically strips away our body's most ancient, natural bacterial armor. The mechanism we rely on to protect us while we're in the water is the exact mechanism that renders us infinitely more vulnerable to infection the moment we step out.
A fascinating biological contradiction to consider the next time you find yourself staring down a sparkling blue pool. Thanks for joining us on this deep dive. Stay safe, stay curious, and we'll see you next time.